What will happen in Puerto Rico when the emergency declaration for the COVID-19 pandemic expires in May? Despite the lack of demand for these services, the main health epidemiology officer of the island says initiatives to detect new cases will continue after the end of the emergency declaration due to the pandemic. Francis Felix reports.
1 month after the emergency declaration for the COVID-19 pandemic issued by the U.S. government expires, the main epidemiology officer of the PR Health Department, Melissa Marzan, assures that the state agency has been working on a transition process for several months to convert the typical response of this situation into routine activities. The doctor explained to a local newspaper in the island that the end of the national emergency related to the coronavirus, which has claimed the lives of more than 5,800 people in the last 3 years in Puerto Rico, does not mean that responses such as fixed detection centers of COVID-19, the administration of tests in schools, long-term care centers, correctional centers and airports, and the delivery of home tests in rural or hard-to-reach areas will come to an end next May 11. It is important to mention that the allocated emergency funds have different periods of validity, and each program within the Department of Health has scheduled its activities according to the validity of those funds. That does not mean that on May 11 those funds will not be there, explained Marzan. The epidemiologist stated that the COVID-19 center test will still be available and free of cost to the general community. In addition, Marzan stated that after President Biden signed a resolution that ends the health emergency, COVID-19 will be under routine evaluation in the health surveillance system. Reporting from San Juan, Puerto Rico, Frances Felix for One Caribbean News.